safety. Okay, so S is for safety first, accident prevention, facilitate positioning because your positioning also facilitates safety, right? Environmental consideration for your letter E, triaging, and your U delegate. Okay, so let's apply your safety. Let's apply your principles of safety with certain questions. Here, the nurse accompanies a newborn parents to their car following discharge from the birthing center. The car seat has been placed in the front seat. The father states, "We want the baby where we can see her." The most appropriate response of the nurse would be what? Would be correct. Number 4. I know you like to watch her closely, but the safest place for the baby is in the back center seat. In the United States, guys, there is a law regarding the usage of your car seats. You have, what do you call this? You have 3 types of your car seats. For your for birth until age 2 to 4, they are supposed to use the rear facing car seat. It's a car seat that looks at the back of the car. Now, we have to use such rear-facing car seat because when motor vehicle or a vehicle or the car suffers from a motor vehicular accident, the impact is not as strong, towards the baby when they are facing in front. Remember, with babies, they still have problems with their neck. They still cannot support their neck. So if they are facing forward, what will happen if they suffer from motor vehicular accident? They will do this. Okay, they will go forward, and again, they cannot support the neck and could cause complications to the baby. So we put them at the back so that whenever somehow the neck of the baby is supported by the car seat. Okay, so what do you call this? Another one is that we do not put it in front, the car seat, because the airbags, the pressure of the airbags when deployed can injure and kill a child. Now, you usually transition to your forward-facing car seat if they have outgrown or the weight of the baby is more than what the rear-facing car seat can handle. Okay, your forward-facing car seat, it's still in the back of the car, but it's looking towards the direction of the traffic already. Okay, for booster seat, after you outgrow your forward facing car seat, but could still not fit into the seat belt, you use your booster seat, usually around ages 9 to 12. It's like what do you call this? It's like your normal car seat, but it's just that you want to increase the height or the seat level of the child because they cannot fit with the seat belt still. With the usage of your seat belt, the criteria for this one is that the seat belt, the one that goes across your chest, should not be in front of the face of the child or should not be on the neck. It should really be on the chest. And the other one, the lap belt, right? Your seat belt has like a slanted L. Okay, the lap belt should be on there, should be across their upper thighs and not on their stomach. Okay, because when the car encounters motor vehicular accident and they have the seat belt, the shoulder belt here in the neck, they could suffocate from it. Okay, with your lap belt, if it is on the stomach, it would somehow put pressure on the stomach and can cause your internal injuries. Okay, so next, with your letter A, accident prevention, which of the following teachings should the nurse provide to the parents of a 2-year-old boy? 1, 2, 3, or 4? Here you can apply your safety precaution for your age groups. Would be your Correct. Use skates at the head and foot of stairways to prevent your falls because your 2-year-old boy is a toddler who is at risk for falls and what is the other one? Falls and drowning. Correct. Your number 1, turn the handles of pots and pans to the front of the stove. Again, we do not do so because if they try to reach for the handles of the pots and pans, the contents of the pots and pans can splash over them, causing burns. And this one is usually for your preschooler. Tablecloth should hang over the edge of the table is also a no. They tend to also tug the tablecloths and the things on the table could splash over. And allow the child to play alone with the balloon is also not applicable for your 2-year-old boy. Next, for your safety would be your facilitate positioning. Immediately after a supratentorial craniotomy, in what position should the client be placed? Your supratentorial craniotomy is the one that looks like that looks like a question mark. Okay, the flap. What do you think is applicable for your craniotomy patients? We put them on semi-Fowlers. Okay? Because if you put them on a supine position, guys, on Trendelenburg position, the pressure can go to the brain. Okay? It can increase, correct, the intracranial pressure of your patient. So somehow, if they are in a sitting position, semi-Fowlers, the fluid from the brain, the blood flow, the blood from the brain can go downwards, decreasing now the pressure. Next, your environmental considerations. In providing health teachings to a client with osteoporosis, which of the following should the nurse instruct the client to remove in home environment? Correct. It would be your scatter rugs because remember your patients with osteoporosis would have brittle bones. And if they encounter such rugs or throw rugs and they slip on it, they would surely encounter fractures. Okay, next. For your safety, your triage, after a storm has passed, the following injured people were brought to the hospital. When determining priority of needs, who among the following clients needs immediate care from the nurse? Who do you think would you prioritize? Okay, 1. How about the others? 3, 4. Okay, the answer actually for this one is number 4. A 30-year-old with severe lacerations involving open fractures of major bones like your hip, your pelvis, open fractures can actually put the patient at risk for pulmonary embolism. Okay, your number 3, a 30-year-old with significant penetrating wound of the abdomen. If the object is still penetrating the wound or the abdomen of your patient, they are still somehow stable. When are they unstable? When are they unstable? If the if the penetrating object is removed because there would be bleeding and can cause hypovolemic shock with their client. But if it's still there, still our concern is number 4. Number 2, a 25-year-old with close fractures of major bones, although this can cause her compartment syndrome. Number 4 is still our concern. Okay, and number 1, a 17-year-old with second-degree burns of 10% of the body. Usually we go for third-degree burns first, okay, within third-degree burns, which we will talk about later on. But really, when it comes to your TBSA, second degree burns of 10% is still low. Okay, so still number 4 because of the complication of your pulmonary embolism. Next, with your safety, you delegate which of the following assignments, if made by a registered nurse, would be appropriate for an unlicensed assistive personnel. 4. How about the others? With your UAP, remember, they cannot teach, they cannot assess, they cannot give medications, okay? Because that's the work of the RN. The RNs are the ones responsible for health teachings, discharge teaching, admission teachings, assessment of any kind, and and your medication administration, your IVs, intramuscular oral medications. So your UAP cannot do so. But number 4, obtaining a urine specimen for routine urinalysis is the answer, because when you say routine urinalysis, okay, you usually help them, the UAP would usually just help them catch the urine in the bottle sample. Okay, that's your urine specimen for routine urinalysis. But, question guys, if it says obtaining a urine specimen from the indwelling catheter, can they do that? No, because that's an invasive procedure already. The manipulation of your indwelling Foley catheters would be for your RNs. Next. Mastering the most common health and safety risk. Remember your ABCDE, your airway obstruction, burns, chemical poisoning, drowning, and environmental hazards are common health and safety risks. Now, here, the nurse did a home visit to a 3-year-old client. Which observations of the nurse in the home environment needs to be modified? 1, 2, 3, or 4? Oh, your 3-year-old client is a toddler. So the safety precaution would be your falls and drowning. Number 1, covered swimming pool. There would be no drowning because it's covered, right? Number 2, gated stairway will surely help with your falls. Number 4, wall-to-wall carpet would decrease the chances of them bumping on the wall and injuring themselves. But number 3, high open shelves is the answer. Why? High open shelves. Those are shelves from the floor until the ceiling, usually, right? And correct, they will climb the shelves. For example, that you put their toy on the highest part of the shelf because you do not want to play with you do not want them to play with it, or you are trying to hide it from their eyes, from their sight. Now they saw it from afar. Okay, they saw it from afar and it's open. And they know that they can climb it. They have this thought that I can climb this shelf in order for me to get what I want. They will start to climb it. Now the problem with that is the what do you call this? The center of gravity of the shelf itself will shift if you put weight on it, which is the child's weight. So it can tumble over and it could cause crushing of the child. So what do we do for high open shelves? We put doors on them. Or what do you call that? We put covering on them, like for cabinets. There's your door for cabinets, right? We can actually put some cover on it. Okay, so high open shelves is an area of concern for your 3-year-old client. Okay, first, let's look at your first A. Your ABCDE, your airway obstruction. Your airway obstruction will always be a nursing priority because it will entail your patient not being able to breathe. Now, there are certain causes for your airway obstruction. You have your TOC, tumors of the vocal cord, trauma in the region, acute infection of the airways, localized edema of the airways, and key factors like your foreign body impactation in the airways and paralysis of vocal cord injury. So here are some lists that could cause your patient not to breathe effectively. Now, to prevent airway obstruction for children or for infants, ensure proper position of infants, lay them on their back, never on their abdomen. If you lay them on their abdomen, what condition is the infant at risk for? Correct. Your sudden infant death syndrome. They could suffocate when they are on their abdomen rather than when they are on their belly. when they are on their what do you call this, on their back. Now, the first aid for choking depends on the age. If they are less than 1 year of age, you can do your back blows and chest thrust. Between 1 to 8 years, you do your abdominal thrust. For example, Mickey Mouse, the toy of my dog, and he has jaundice. Okay, so for example, that Mickey Mouse is less than 1 year old. Okay, how do you do your back blows and chest thrust? You have your hand, okay? You use the heel of your hand, okay? Heel of your hand to forcefully do your back blows. You put Mickey Mouse on your thigh, okay? On your thigh, you support them with your thigh. You hold them like this one, okay? Like this one, okay? Somehow like that. And in the middle of your scapula, in the middle of the scapula of the kid, you do your blows, okay? 1, 2, 3, 4, 5. Okay, and then you turn them face up. Okay, turn them face up now. And then you do your chest thrust with your 2 fingers, your index finger and your middle finger between the nipple line. So 1, somehow below but between the nipple line. So 1, 2, 3, 4, 5. And then you assess whether there is whether the foreign object is already in the mouth. Question: if the object is at the back of the throat, do you try to remove it? If the object is in the back of the throat, do you try to remove it? No. Okay, that's called your finger sweeping, correct. We do not try to remove the object if it is still in the back of the throat, because when you try to put your finger to remove it, you can actually push the foreign object further down. But what if, okay, what if the object is already on the cheeks of the patient? Can we remove it? At that time, yes, because you can easily try to scoop it out. Okay, now how about your abdominal thrust? Formerly, we call this one your Heimlich maneuver, but we no longer use your Heimlich maneuver. We use the term abdominal thrust maneuver. With your abdominal thrust maneuver, you first ask them, can you talk? Okay, if they say they can, okay, or if they say yes, but I'm choking, okay, you do not leave them at that. Of course, you still have to do your abdominal thrust maneuver. Asking them if they are able to talk just lets us know if there is a partial or complete airway obstruction. Now, after that, you go behind their back. You go behind their back and then you hug them, you snuggle them, or you straddle them. Hugging, and then you form a fist with one hand, clenching with the other. You put it in between your xiphoid process and the umbilicus, and then that's when you push upward. Okay, upward motion, the pressure of your the pressure or the air that is trapped in the lungs and the pressure that you are exerting on the in between your xiphoid and the umbilicus could cause the foreign object to go out. Okay, so here is an example of your back blows and chest thrust position. So again, put them on your thigh. Somehow the body of the baby is lower than the head, so that by gravity the object can come out of the mouth. So again, like that, and then do your back blows with your palm. This one, the heel of your palm. Now here is your chest thrust with the usage of your middle finger and your index finger. It's like you're doing CPR to the baby. Here is your abdominal thrust maneuver. Again, you ask them if they are able to speak, so that we are able to assess if they have a partial or complete airway. Do not thrust hard enough to lift the child off his feet, or else the abdominal thrust maneuver will not work. Now, here, a nurse should perform, my PowerPoint is laggy. A nurse should perform the Heimlich maneuver in the following